Hello, everybody. Welcome back to another episode of She's in Sync. Today, I have a very special guest, Dr. Kayla Borchers. And Dr. Kayla and I have gone way back, and it's been really a journey. So I'm so excited for her to be on the show. Dr. Kayla is a holistic orthopedic and pelvic health physical therapist, prenatal and postpartum corrective exercise specialist, and mama of three with a fourth on the way. And as the founder of Holistically Well, she blends modern medicine with a holistic approach to empower women before, during, and after pregnancy through her evidence based online programs for preconception, pregnancy, and postpartum. And Dr. Kayla helps women take the guesswork out of exercising and feeling strong in every life season, all from the comfort of their homes. We've done a couple episodes where I focused on coming off birth control and natural pregnancy prevention options. So today we're going to really be speaking to a woman who wants to get pregnant, and her goal for coming off birth control is to conceive, have a healthy pregnancy, a healthy baby, and to take care of herself all throughout that process. And we're going to be speaking to what we can do from an exercise perspective, pelvic floor, and also just all the ins and outs of, are there any supplements that she recommends? Are there any specific foods, lifestyle modifications for healthy pregnancy and beyond? So welcome to the show, Dr. Kayla.
Thank you so much for having me. And this conversation truly lights me up because I am so passionate about this. As you said, I'm pregnant with my fourth child, and with my first experienced extreme nausea. I had a delivery that became emergent. They rushed about 20 people into my delivery room, a scalpel ready to do an emergency C-section. This was after 24 hours of labor and an hour and a half of pushing, with baby's heart rate decelerating and meconium in utero. Which is like baby's first poop, which can, if it's in there for too long, start to increase risk of infection. And so there was a whole pediatric NICU team there ready to take over for baby. And then my darling daughter came out absolutely screaming her head off, which was the most beautiful sound that everybody wanted to hear because it meant that she was perfectly fine. And so 20 people left my room, but my husband was like, there was literally a physician standing there with like a scalpel and like gowned up, like ready to go. And so I share that because before that first delivery, I was a sports medicine physical therapist. I was exercising. I was running throughout the entire pregnancy, which if you hear that, you're like, that's amazing. You stayed super active. But something consistent with that was I was so tight. A lot of runners, a lot of those who are type A, go, go, go. We hold a ton of tension in our pelvic floor. And I never knew how to relax my pelvic floor. All that we're told is to do Kegels. Kegels are going to make the issue worse if you are somebody who holds extra tension in your pelvic floor. And so I share this background because I want to counter that with my second delivery and my third delivery, where I delivered very smoothly and quickly on all fours with my second kiddo, and literally in standing in the restroom with my third kiddo. My goal with my second and third was to have a water birth, like this peaceful water birth. And I didn't make it to the tub with either of them. Like there was not enough time to literally fill the tub with water because those babies came quickly, which I won't complain about because if you've ever been in labor, you will not complain about going a little quicker. And I didn't tear. That's important to note too. Thankfully, I didn't tear with my first either, but I have not torn with all three of my deliveries. And my second and my third babies were about 9 pounds. So that's just so important to understand. My first was 6 pounds. And so I think that's why I was able to not tear with her, even though I didn't do a ton of prep work. She was a smaller baby. And since it was such a long pushing phase, that pelvic floor had a chance to really expand and then retract, expand and then retract. But with the second and third, if you have a quick delivery, you are at an increased risk of tearing, and I didn't. And this comes back to prep work, and it truly starts preconception with so many of the nuances that Taylor recommended. I love that she is educating you all how to come off of birth control in a truly optimal way, because if that is part of your story, that is going to be such a huge part of laying the foundation for then what comes next, which is what we are talking about today. And that is preparing your body. So from a physical standpoint, We need to look at the pelvic floor muscles. Are you holding extra tension there? Many women are. And again, Kegels are going to make it worse. That's the opposite of what you need. Instead, we need to learn breath work. We need to learn that when our diaphragm drops, it pushes all of our internal abdominal organs down into the basin, the bowl of your pelvic floor. So those pelvic floor muscles, if they are not moving, all of those internal organs are just kind of slamming into a brick wall. And if we think about this from a blood flow standpoint and a fertility standpoint, that's not optimal for our reproductive organs, right? What we want is this beautiful pressure exchange that as the diaphragm drops, the pelvic floor drops as all those internal organs move down. As we exhale, diaphragm lifts, pelvic floor lifts, and it gently massages those internal organs up and down. We also get a nervous system benefit with this, as when the diaphragm drops, it activates our vagus nerve. So that is going to take us out of fight or flight mode and instead into this rest and digest state, which is extremely important for a safe space to conceive, because the body needs to feel that it's a safe time and that we are not in survival mode, right? So breath work is where I really start to lay the foundation for both the pelvic floor and the nervous system. But then also developing an exercise routine that is going to support the muscles surrounding your pelvis so that we don't start pregnancy from a state where we are weak in those areas and setting ourselves up for a ton of pain points.
Yeah. Well, and I think that's so helpful for you to share. I actually didn't know that. I thought all three of your pregnancies you had prepped before. So
Okay.
that's good to know. Like we both got into the spaces that we are in. Like we left our full-time corporate jobs like to have our own private practice because we saw a gap in our spaces. You in the physical therapy space, me in the nutrition dietetic space, and this lack of support around our own health journeys. And so the fact that you had that traumatic first pregnancy or birth experience, you were like, okay, like, no, there's a better way to do this. So we're very much proactive versus reactive. And so you really focus on, like what you were just describing, the deeper inner workings of how can you prep? That's the biggest word that I use all the time. How can we prep to have you know, that smooth pregnancy, fertility journey and birth experience?
Absolutely. And with my first, I was with a midwife group. I had read all of the natural childbirth books. I did some prep work, but when it came to like from a pelvic floor physical therapy standpoint, I did not. Like I was totally disconnected from that portion of my body, and we were never educated about how to relax that area, right? And this is coming from me as a physical therapist. So I realized there's this whole other realm to physical therapy, which is women's health PT, pelvic floor PT, but often that is so siloed and women are only sent there if you're having issues. So I had, from all accounts, a very healthy pregnancy, as I mentioned, very active pregnancy, a pain-free pregnancy. But when it came to delivery, my body had no way to relax. It didn't understand how to do the actual delivery process. And I was laying on my back in a hospital bed with my knees wide and my feet in, which is external rotation of the hips. So to get scientific here, it actually closes the pelvic outlet where baby's body needs to birth through. And so when it comes to pushing, we really should have the knees in, the feet out. Ideally, we're in a position, as I was with my second and my third, where the pelvis can move in all directions. So you're on all fours, or you're in side lying, or you're standing or squatting. And I wasn't. And so that is really the nuanced education that I had then diving into the second and third of, yes, there are things we can do before we even get pregnant, during pregnancy, and then leading up to that delivery that are going to make that experience so much smoother.
So you're saying, like, if I'm hearing you correctly, like how the standard, you know, beds, I guess you call them,
Yeah.
right? Like how
Yeah.
they're set up, it's not actually like correct for
No.
a smooth childbirth experience. Like the way you're laying is not very helpful.
Absolutely. It's set up for your gynecologist to have the optimal
View.
biomechanics for themselves. Yeah, the
Yeah.
optimal view for them. They can sit on a stool. They've got upright posture.
Mm.
Like they're in a great position. It's going to be great for their back, their body, right? But it is not great for the birthing mother. And it is the worst position biomechanically for a baby to move through the pelvis.
That's so interesting. So
Mhm.
I've never heard that. So if
Yeah.
let's say someone is not at where they want to have a home birth or they don't feel comfortable with that, but they are going to be in a hospital. Is there any specific way they should be moving or laying, or is there an alternative that they can do?
Yeah, so all three of mine were delivered in a hospital, but with a midwife group within the
Okay.
hospital setting. So all that to say, yes, you can deliver in any which way. Now, if you have an epidural, we are more limited. So if you have an epidural, you are going to have to either be on your back or in side lying typically. So on your back, what I'll suggest patients do is get a towel roll, like, a hand kind of towel, roll it up long ways. So you've got like a long cylinder, and then put that in a U shape around your sacrum. So the sacrum's like that back middle portion of your pelvis. And that's the portion that we need to move to get out of the way. It includes your tailbone at the tip to move and get out of the way. And so having a U-shaped towel around it is going to give it some wiggle room versus it being what your pressure is through on the bed, right? So that is one option if you're on your back. And then you want to, as you are transitioning from labor. So when you are laboring, the knees out, feet in is actually great because it's opening the top portion of your pelvis. We want baby's head to descend from our belly area down into the pelvis. But as we get into pushing, we want to have knees in and feet spun out so that we can now open the bottom part of the pelvis. So that is something that you can request your partner to help with. So you could have your husband on one leg and then have a nurse on the other leg, because the stirrups that they have automatically put us into that knees out, feet in kind of position, right? So, or you can have your feet in the stirrups and then have them kind of push your knees in. So relative to your feet, your knees are in. So the nursing staff can help with that. Your support people that you bring into the room can help with that. And then the other option would be side lying. So if you have had an epidural, you could be in side lying. Somebody would support that top leg. And then again, we would want to spin your foot up so that your knee is down, your foot is up while you're in that side lying position. What's great about side lying is now that sacrum, that back portion of your pelvis can move, tailbone can get out of the way. A lot of women will come to me with tailbone pain post-delivery if they've delivered on their back with none of these recommendations, because it just gets stuck. It gets crammed as baby tries to move through that pelvis. But then, so if you don't have an epidural, so with my first, I did have an epidural. After 18 hours of labor, I was like, I need a rest. With my second and my third, I did not have an epidural. And my second, I was able to deliver on all fours. So same thing, you want knees to be in, feet out relatively, and I was able to push in that position. It's a wonderful position where all portions of the pelvis can expand in all directions exactly as they need to. You're also using like the benefits of gravity. You'll just kind of naturally tilt your pelvis down as the chest might come up a little bit. And then with my third, I delivered the head literally on the toilet. If you've never been through this before, when it's time to push, you get this like pressure sensation. And sometimes you feel like you need to use the restroom. And so they were filling the tub, and I was like, I'm just going to go to the restroom and then we'll get in the tub and it's all going to be good. Well, I ended up delivering his head completely by myself. Nobody else in the restroom with me, which is wild that, they let me do that. But I don't think they knew that I was about to deliver that.
You knew, yeah.
Yeah, I didn't know either. I thought I just was going to get some privacy to use the restroom. Then I yelled for my husband. I'm like, the baby is coming now. So he rushed in. Everybody rushed in. I stood up. They helped me stand up from the toilet. I took like 2 steps forward so I could like get into just a slightly squatted position. And then I delivered the rest of his body right there, literally in standing. And it was amazing because if you think of the impact of gravity on that, like, it's helping you, right? And again,
Less pressure on you, like literally.
yeah, literally. And so your uterine contractions are just working with that pull of gravity, and like it happened so quickly. So there's a lot of options here where we can use gravity to our benefit, where we can give the pelvis more room to expand. So from a physiological standpoint, it really makes so much sense when you think about it. But yeah, when we think of TV shows and movies, what is portrayed is always on the back, yelling, screaming and feet in the stirrups. And it really does not need to be that way. We can be so in tune with our bodies. And a lot of times when you are really in tune with your body, you just naturally feel what position you want to get into. And it's a beautiful cascade how it just unfolds.
I'm so glad that you said that, because this just really speaks to, and I don't want to say everything, but just a lot of the mainstream medical practices are not built for women, even childbirth. Like, this is crazy that it's like the standardized, like, this is how you should lay, this is how you deliver, is not optimal for our body to deliver in a
Mm-hmm.
comfortable way.
Yeah.
So that's so, so helpful for people listening. I'm so glad that we touched on that. So we talked a little bit about when you're actually like literally giving birth. What are some things that, in terms of like exercises that you can do? Because you said like Kegels are most likely not, solving the problem. They're making things worse
Correct.
oftentimes. I don't know if it varies, like if you've, for your first or if it's multiple deliveries after that, but what are some things women can do like before PT wise?
Yeah. So if we're talking about before they're even trying to conceive, let's say you're 6 to 3 months out from trying to conceive and you're like, okay, I want to start prepping my body now because as soon as you conceive, pressure changes start happening in your body, right? And so your pelvic floor, your core are getting different inputs. And so it can be much harder to connect with those muscles and essentially rehab those muscles when changes are already unfolding. So ideally, yes, we would start before conception and breath work is going to be key first. That would be, a nice inhale through your nose, mouth is gently closed, tongue is resting on the roof of your mouth, jaw is relaxed. Because when we hold tension in our jaw, it holds tension in our pelvic floor. So relax that jaw. You're going to inhale through your nose for about 6 seconds. As you inhale, you want to feel belly, side ribs, low back, and pelvic floor expand in all directions like a balloon filling with air. And then on the exhale, we want it to be about twice as long as the inhale. You're going to blow out through your mouth and you're going to feel pelvic floor gently lift, belly, side ribs, low back, all recoiling in like a balloon is losing its air. That is going to be your nice relaxed version of a diaphragmatic breath. So start with that. Then you want to work on active diaphragmatic breathing. So that is pairing a pelvic floor contraction to begin your exhale with a movement. So for instance, we could do this with a bridge. So laying down on the floor, knees bent. On the exhale, we gently engage pelvic floor, tighten our buttocks muscles, bridge hips off the mat, hold for the duration of your exhale, feeling your deep core muscles kick in. You can find your deep core muscles by putting your 2 fingertips right inside your pelvic bone, right inside your hip bone, and you'll feel a tightening underneath those fingertips as you continue to breathe out. Then as you inhale, you'll lower the hips down. Same thing with the squat. We would inhale down for our squat. And then on your exhale, you can think of lifting a marble through your vaginal opening. That's going to help really make sure we're connecting with the pelvic floor muscles and not compensating with all of the muscles surrounding the area. So you can envision closing your vaginal opening around a marble, and as you breathe out, lifting that marble up and in. You'll then rise to stand, engage glutes. As you keep blowing out, you'll feel that deep core gently tighten, brace, and support you. So the pelvic floor and the deep core really work in unison. It starts with the breath, but then we pair that breath with movement to make it super functional. So squats I love, lunges, bridges, Romanian deadlifts or deadlifts in general, where we're kind of working on that hip hinge motion. So this just puts the body in various functional positions that once you are pregnant, you're going to be putting your body in. And if your pelvic floor and your core don't know how to support you when we have no pressure changes from a pregnancy, how is it going to support you when you're actually pregnant, right? So that is super important to focus on. But then I also love supporting the stabilizing muscles around your pelvis so that it isn't all up to the pelvic floor and the core, right? And so this would look like side lying leg lifts to target the side glute muscles, fire hydrants, so if you're on all fours and you're opening a bent knee out and open to the side. I use a lot of Pilates or yoga-based movements, bar-based movements, where it's really focusing on those little support and stabilizing muscles. And I actually have a free flow for this. So I have a preconception free guide that I will give Taylor to put in the show notes, but that gives you like a 10-minute mindful movement to flow through where I talk you through the breath work and we pair it with movement. So that gives you a really good starting foundation for how to support the body through movement preconception.
So for example, like the Romanian deadlifts, the squats, do you recommend doing those? Because I think this is really important because I know I have some clients who it's like they're like the heavy weight lifters and stuff, but since you're focusing on breath work with it, do you recommend like really heavy weights or maybe going a little bit lighter and really focusing on that breath work with it?
I love this question. So I would do your first set with a lightweight. If you're used to doing heavy, with a weight that you can do it very focused on your breath. So for some people that would be just body weight, like no weights. And your focus there is on support, on stability, and on breath, right? Then your second and your third set, you could pair with weight. You should still be able to exhale on the effort. We do not want any breath holding. So for those that are doing like heavy weightlifting and they are holding
I
their
was
breath
asking.
to brace, we do not want that. So you need to be at a weight where you can also breathe. So you can still lift heavy. I'm a huge fan of resistance training for women for metabolic health, building muscle. It's great. You have to be able to breathe through it because when you are bearing down and holding your breath, it is sending so much pressure into that pelvic floor. This is increasing your risk of prolapse, urinary leakage, herniation. And if that is your habit formation ahead of pregnancy, like we are asking for issues in the pelvic floor and the core when it comes to pregnancy.
Well, and I think this is a good just shifting of mindset for women because you and I have talked like a lot of women that we work with, they're like very health conscious and like, you're used to doing like, I don't want to say like health fads, but they're very just aware of like, okay, like I want to be the healthiest I can be. So I'm going to the gym and I'm lifting heavy and I'm doing these things. And so I feel like sometimes it can be a little bit like frustrating or it just requires a mental mind shift when you are pregnant and maybe you have some morning sickness or you're more tired or postpartum like you have to take more time off from these heavy more intense workouts. So I almost think from a mindset perspective it's also helpful to start working on that before you get to second third trimester or postpartum to really remind yourself like you're still doing really good work, even if it's lighter weight, or you're focusing on the breath work, or you're doing maybe more like bar Pilates with lighter weights versus just feeling like you always have to lift heavy for it to be the max benefit. I think it's just really important to come at it from that holistic perspective.
Absolutely. And if we come at it from a nervous system standpoint, if you are lifting to maximal exertion to the point that you're having to breath hold to brace, that is spiking your cortisol. That is spiking the nervous system response to that fight or flight mode, right? And so, if you are a woman who is trying to conceive or wanting to conceive in the near future, biologically, the body reads that as we are doing very heavy activities that are extremely stressful to the body every day of the week. It's not a safe time to carry new life, right? Because biologically, our body doesn't know if we are doing that because we are building a home for our family to live in and we're lifting heavy things to literally create space for us to live, or if we're doing that for fun, so it's just important to note that. And I'm not saying you should never lift heavy. Again, I think lifting heavy is great, but you do need to do it in a way that's going to support your body. And so that might mean dialing it back a few pounds so that you can exhale. And it can be a forced exhale where we are bracing, like absolutely you can brace, but you need to be able to exhale on the effort. You need to be able to breathe through it so that we are not getting that bearing down pressure.
Yep. Yeah. I think that's such a great point. So, what about exercising during pregnancy or postpartum? Is that kind of the same recommendations or would you alter those at all?
So different. So, I mean, okay, it comes back to the breath again, but my goodness, like during pregnancy, it's such a beautiful time of where your body is constantly changing and shifting, and we are just supporting it, right? So I did create a pregnancy program that has about 50 plus movement videos for you that targets your deep core, how to progressively strengthen the core and the pelvic floor throughout pregnancy, and those hip muscles that we can offload the pelvic floor so that we aren't getting that heaviness feeling in the pelvic floor from added pressure of growing baby. There are so many layers to this, and it literally lights me up to have created a resource that you can press play on from the comfort of home, because when you are growing a baby, you have appointments with your midwife or your OB. You are still working a lot of the times, and there's just so many moving parts. You're preparing the nursery, you're preparing for baby. But a lot of times the mom's health is forgotten about, right? We make that list for, your baby shower and all of the things, but you're not taking time to tune into you. And then women struggle with sciatica. They struggle with prolapse. They struggle with peeing their pants. And it's like, it doesn't have to be that way. So I recommend at least 3 to 4 times per week. In an ideal world, like 5 to 6 days a week, you're pressing play on a video from a pelvic health PT, such as myself, that is teaching you how to connect with your pelvic floor, your deep core muscles in a progressive way, because we can build strength during pregnancy, which is amazing. So if you're somebody who's like, I haven't worked out in this way before. I don't know how to connect with those muscles. That's okay. I give you the starting point on where to start. That's easier. And then we progress. And your body is naturally progressing its own resistance during pregnancy because baby is growing. So it's by the end of pregnancy, it's like you've got a 30-pound weighted vest on your body, and that's what you're doing your squats with, right? So we have to keep that in mind too. You can still use weights, but just body weight, you've already got 30 extra pounds on, right? So it's amazing. And I cue you to listen to your body and all of that. But absolutely still want you to work out during pregnancy. But I do, particularly during the first trimester, recommend more of this mindful movement approach where we are not overexerting the body. Unfortunately, before 12 weeks of pregnancy, some studies will say as high as 1 in 4 pregnancies end in a miscarriage. And that rate is increased when we focus on high intensity interval training, when we're focused on maximal effort exertion, because it comes back to biologically if the body feels safe or not to maintain that pregnancy, or if it feels like it has the most available resources, when it comes from an undernourished standpoint or a nutrient deficiency standpoint, right? If we look at that versus exercise output, the body can be over exercising and undernourishing, and that is not a good state for the body to be in when growing new life. And so we need to focus on nutrition and nourishment of the body. And we need to focus on supporting the body through movement, but in a way that is not overtaxing our nervous system. And then as you move into the second trimester, we naturally can shift into a little bit higher level, moderate to high intensity exercise, because now that placenta has formed, we don't simply only have the egg yolk sac, like baby is more robust, if you will, and our body can tolerate a higher level of stress. And that stays through the beginning of the third trimester. And then you will just naturally feel as you get closer to the end of your third trimester, maybe 34-ish weeks of pregnancy, like, whew, I feel like I need to tone it down again, right? Because now your body is preparing for what we need for delivery, which is full relaxation of the pelvic floor. And so it really is like this bell curve. And so it's important to program that out accordingly versus just doing the same thing the entire pregnancy.
I was just going to say that. That's one thing I was thinking is like, I feel like if you go to your doctor or your OB during your pregnancy, right, they're just going to be like, stay active. Like, that's it. They're just going to be like, exercise as much as you can, like, stay active, eat healthy, like, just so
Mm-hmm.
cookie cutter versus what I'm hearing from you is like, with everything, right? Like, it's so individualized and it will ebb and flow throughout your pregnancy, which is why it's so important to have a specialist in that area like you guiding them along the way and telling them, okay, like, you're here, this is what your body needs. And also, teaching women how to listen to it and to tune in versus so many women are disconnected from their body and what it's telling them.
Totally. And that is something I really highlight in my programs is if you feel this, then do that. If you feel this, then do this, because not everybody's the same. And so what works for me may not work for you, but I have worked with hundreds, if not over 1,000 patients at this point. And so I see not only what I feel in my body, but I see what other patients feel in theirs that I have treated throughout the duration of their pregnancy. And so I think that's just really important to recognize, because there are different cookie cutter programs out there that say this is the one way to do it. And it's like, no, from a rehab standpoint, from a physical therapist standpoint, it is bio-individualized. But how do we do that on an online program? Well, it's because I give you cues in different areas. I have videos specific to, if you are feeling sciatica, watch this video. If you are having SI joint pain, do this. So I really break it down to individualize it as much as possible, and teaching you how to listen to your body so that as you move through yourself, you can become very in tune with what you're noticing. And then that gives you the tools to take that to a CrossFit class, to take that to your Pilates reformer class, so that you can still do the workout techniques that you really enjoy, but you're going to have the innate tools to start educating yourself as you're moving through whatever group class you enjoy, so that you do it in a way that's going to support your body during your own pregnancy.
And if someone's, maybe someone's working with me to like prepare to come off birth control and their ultimate goal is to get pregnant afterward, how soon ahead of time should they start doing some of these exercises and start, maybe start your preconception program? Am I hearing you correctly when you say like 3 to 4 months-ish before?
I ideally would say 6 to 12 months, like
Okay.
3 to 4 months on the low end of the time frame,
Okay.
because we are going to notice changes in that amount of time. But in an ideal world, I would say a year to a half year ahead of time, so you have time to implement these changes. In my Holistically Well Preconception program, I don't just take you through movement. I also take you through how to reduce toxin load in your home, right? And so if time is on your side, then we have time to be like, okay, as this product runs out, I'm going to replace it with a different product. And it gives you time to work through your personal care products, because there are remarking studies coming out now about the amount of microplastics in the umbilical cord and in baby's blood. And so giving your body time to detox and to really focus on making those changes, ideally a year before you conceive, is going to set you up for the optimal success. Now, it takes 4 to 6 weeks for true muscle change to occur. So from that standpoint, a month and a half is going to give us enough time. But from a holistic health standpoint, I love having that full year runway so we can make all of these different changes, and then it doesn't feel overwhelming. I outline my program to be a 6-week long program. So that fits that, 4 to 6 week time frame. But then you can come back to it and you do one thing each week. So again, it's just not overwhelming.
Yeah, so it also depends on your foundations, right? If you're already
Yes.
you're very aware of, you use the EWG to like check your products and all that, but if it's mostly just like the strengthening exercises, the breath work, all that, you like 4 months may be optimal for you and may
Yes.
work. But if you're, really having to overhaul some of your beauty products and your home care products and all that kind of stuff, because that's something I definitely focus on too, is like from a liver standpoint and a detox standpoint, like that also is burdening your liver in addition to birth control. I talk about that in other episodes. So there's so many different facets to this, which is why, again, investing in yourself as a mom to be is so, so important. It's not just about the baby, it's about you, because you are growing that baby and you matter too. So
And by showing up best for yourself, you're going to show up best for your baby, because you're creating the optimal womb for them to grow in. And then postpartum, to touch on that from a recovery standpoint, it is so much easier to recover from a non-medicated birth. And so doing that prep work ahead of time in pregnancy, obviously it's easier to recover from a vaginal delivery versus a cesarean section. So, I program in hip mobility exercises, breath work for pushing, how to get baby in optimal position. There's different inversion techniques that we can do during the 3rd trimester of pregnancy so that baby is head down and facing your sacrum versus what they call sunny side up, where they're spun the opposite direction. So there's a lot that goes into it ahead of that actual delivery to then give you the best postpartum. And as with anything, the stronger you go into it, the more mobile you come into it, the more nourished you go into it, the better you're going to come out on the back end for your body to be able to heal. And so then I have a 12-week postpartum program that takes you through step-by-step on how to heal and rehab all those muscles postpartum. And so again, that's just going to be progressive and talk you through how to be in tune with your body as you heal.
let's shift gears and talk a little bit about endometriosis, because
Oh, okay.
as I was preparing for this show, I do have a client right now who is working with me to come off birth control without painful periods. She was put on it to help with her endometriosis, right? Air quotes. And we know that like her biggest fear is she wants to come off but not have debilitating periods. And her and her husband want to start trying for their first baby. So with endo, a lot of times there's this story to women who are suffering with this of like, you're going to have difficulty conceiving, you're going to like you may not be able to have a baby. Like there's just a lot of fear around it, combined with the fear of having debilitating periods, so that's what her and I are working on. And we're also being really proactive with conception. So you have a blog post on this, and it really was talking about specific ways to break down the fascia that comes with endometriosis. So I'd love to hear your perspective on holistically treating endometriosis for fertility and conception and beyond.
Yeah, I love this question. So there are ways that we can help mobilize the fascia in that core, and it's more of a softer approach. And then we can also get a little bit deeper, but it's breaking up the inflammation beneath the surface. Red light can be great for that as well. So I will treat patients, if I'm seeing them in person, I will do hands-on, like work on them and then teach them how to do it at home. If somebody is virtual, I talk them through how to do it on themselves. And what's neat about that is they get that feedback to me right away of, oh, I'm feeling this. And we can adjust the pressure, we can increase the pressure, all of that. Red light therapy, I'm a huge fan of. That is going to help stimulate healing, collagen growth. It also reduces inflammation. And so that's really the big thing when it comes to endometriosis. I definitely recommend that we work closely with their doctor. I'm a huge fan of NAPRO certified specialist who, yeah, can really get to, again, the root cause. So I would certainly recommend that they see one of those if they haven't yet, and make sure from an internal standpoint, anything is taken care of that needs to be. And then that's where PT comes into play. I have a number of patients now that had a surgical removal, and then they're working with us now for like scar tissue healing, optimal mobility and blood flow of the fascia. That's going to also increase blood flow to those reproductive organs, which is huge. But then when it comes to that stress, that stress of it, it is absolutely learning how to calm that nervous system, because stress, worry, anxiety is going to, again, put us in that fight or flight mode and that stress state of where it's not a safe time to conceive. And so we need to do a ton of mindset shift work to trust our body again, and to trust the prep work that she has already done with you and potentially with her NAPRO doctor, to trust that that changed things, right? She's not in the same state now that she was before she started this journey, to understand she's in a better space, to understand there are things that we can continue to do to support the body. You know, in terms of supporting detox pathways, sauna is wonderful. So to do that prior to trying to conceive, you can do that right up until you're pregnant. And once you're pregnant, we would want to stop sauna sessions, because that's going to increase internal body temperature for a baby, and that can lead to increased risk of birth defects. And we also don't want to be actively detoxing when we're pregnant, because that mobilizes toxins into our blood, and we don't want to be mobilizing toxins to baby. So kind of those extra detox pathways are great prior to trying to conceive, but once we're actually pregnant, we want to pull back from those.
I was gonna say, when you say actively detoxing, so you're talking like the sauna, or is there anything else that you think of when you say actively detoxing for someone who may not know what that means?
Using like activated charcoal binders, castor oil packs on the liver, you know, those are helpful things prior to conception. Yes. But once
I work
we're,
on a lot of that with my clients, you know, a lot of them just who are on birth control, but specifically endometriosis, a lot of detox
yes.
stuff to detox estrogen, to help with inflammation. So we do a lot. I recommend like the sauna. I love the red light. I didn't think about that, but that's so
Mhm.
true with the breaking down and just healing specific foods, liver support, all that. So doing that for fertility, but then when you get to that pregnancy point, that's when we should pause, but all the more reason to do that prep work ahead of time so your liver and detox is optimized before.
Exactly. And then in terms of supplements, I am very pro taking a good prenatal to cover your bases when it comes to all those micronutrients, but we need a really good one. There are so many out there with junk in it and synthetic ingredients. And so the one I use and recommend is called Fullwell
Me too.
Fertility. Yeah,
Yep.
so they use methylated folate in its most bioavailable form. They have great levels of choline. And so I bring this up because if you are consuming like a folic acid based prenatal, which so many of them, even those from quote good brands, I will always look at the prenatal a patient is taking, and it will say
Same.
X amount of folate, but in parentheses, it will say 800 mcg as folic acid. And so somebody thinks that it's folate because that's what it first says, it's like a methylated folate, but over half of it is actually from folic acid. I'm like, no, that's junk. And there are, again, like greenwashing brands, like brands that, you know, are quote clean, that have that. And so you have to be very careful.
Yeah, I love Fullwell. I'm like taking notes. I'm like, I'm gonna put the sauna recommendation that I love, the prenatal that you and I both love, like all that will be in the show notes because yeah, I same with multivitamins too. For a lot of my clients, they're taking a multi, and I'm like, ooh, this is not good. Stop
Yeah.
taking this. This is actually making things worse. So
Right.
same with prenatals.
Right, exactly. So Fullwell is great. And then I am a big fan of like desiccated beef liver, either working that into your just diet 3 to 4 times a week or taking a supplement if you are not on board with cooking with it, totally fine. I also love collagen. So I am a big fan of putting collagen in my coffee each morning. It helps regulate that blood sugar as well and gets that boost of protein first thing in the morning after eating your breakfast. Drink water, eat your breakfast first, and then you can have your coffee with collagen. But that's going to give the body its building blocks to heal, particularly if you've had a surgery for endometriosis, or just in general. It's also going to give your body the building blocks to then grow once you have your baby. So that is super important. And then just coming back to nervous system regulation, that's going to help reduce that pelvic floor tension. It's going to help just gently massage those internal organs to promote healing there and optimal blood flow. So those would be some top recommendations specific to endometriosis.
And those are good for fertility in general too,
In
even if someone
general,
doesn't have
exactly.
endometriosis, like the beef
Hmm.
liver, the full well prenatal.
Yes.
Yeah, all of those are the detox, all of those things too. But specifically for those with endometriosis, because of the mechanisms behind it, that's extra important.
Hmm. Exactly.
How do you feel about NAC, N-acetylcysteine? Because I've heard some people are really pro that for specifically endometriosis and fertility.
That I don't have a specific opinion on.
Okay.
Yeah, I have not dove into the research for that one too much yet.
Okay. Yeah. I oftentimes will recommend like ginger turmeric too, just to help with inflammation for endometriosis as well. That's more of a pain management
Hmm.
perspective, but I mean, those are good natural compounds to incorporate too to help with inflammation in general.
And totally pregnancy safe.
Yes. Did we talk about like specific exercises for that? I think we did, like in terms of
Yeah, I mean, really
like
coming
the
back to the
body.
nervous system work that I
Yeah.
recommend across the board. I mean, I would go back to those same recommendations. It doesn't really change. It just, we do have to focus more on that mindset piece, because if you have had this belief your whole life that you're going to struggle to try to conceive, that can be really hard to move past. And just from a personal approach, I was told at 16 that I would struggle to have children someday. Like, that is what my gynecologist told me. She recommended that I get on birth control to, and Taylor will laugh at this quote, have a period, because I was getting a
Regulate your
period.
cycle.
Yeah, I was getting a period once a year. I was a 4-sport athlete. I was probably underfueling my body and over exercising, and not from a standpoint of like, I did not have an eating disorder. It was not on purpose. It was just literally like
Very active.
very active high school athlete, and just eating normal, but just not enough for what my body needed for the amount that I was outputting. And so I was told at 16, I would struggle to have children someday. And that's what really started me on this journey. I cut out toxins, as soon as my husband and I got married. I just started doing this deep dive for really that full year of our marriage. And then we were ready to try to conceive a year after being married. And I conceived on our very first cycle of trying. But I had laid the prep work that whole year prior, and even before that, to regulate my cycle first, but then to really prep the body preconception from a nutrition standpoint, from a toxin load standpoint. And yeah, it makes a difference. And so that shifted my mindset of, okay, I have done everything in my power to prepare my body preconception. Not yet from a pelvic floor standpoint, as we touched on earlier, that came later, but from a whole body health standpoint. And so to then trust that, to trust that you've done all that you can do, and to let go of the rest, because we can only control what we can control. And the rest, there is an aspect to this that is up to God. If you believe in a higher power, as I do, there is a part of this that we can't control. We don't know with 100% certainty if you are going to conceive on that first cycle. But either way, just kind of offering it up and knowing that you can control the controllables, and then everything else, stressing about it, worrying about it, it's not going to help the situation. It will only make it worse.
And then the last thing I think I want to wrap up on is the male's role in fertility, because
Yes.
we focus so much and on the woman, and it being, like the woman has to do all these things, which like, yes, of course, we talked about all these things we can do, and how it is also really important for us to take care of ourselves like throughout our life cycle. And there is this male role too. Like your guy has to be healthy for a healthy, pregnancy journey too. So can you speak a little bit to the male's role in fertility?
Absolutely. So I love when couples come at this together, when the male wants to learn too. With my preconception program, I'm like, watch these modules together so that your husband or your partner understands why you're wanting to make these changes, right? Because I have some women who are so gung ho on, yes, I'm going to make these lifestyle changes. I'm going to swap out our cleaning supplies. I'm going to swap out my makeup. But their husband is not at all on board. And he's like, well, why are you spending more on cleaning supplies now? And it's like, really, it does not have to be more expensive. But sometimes the upfront is just to initially make that shift. Or he's like, this laundry detergent doesn't smell good anymore. That was
Yeah,
my
like, why do
husband.
we have to order it from here versus getting Lysol at, Kroger or something
Yeah.
like
It's not as simple, right? Because a lot of times you have
Yeah.
to order online. You can't just go to Costco and get like a huge
Yeah.
Tide laundry detergent. My husband was like, when I swapped out our laundry detergent. He's like, just doesn't smell as fresh. And I'm like, it's
Yeah.
still
Well,
clean
I
because
was
he
gonna
was,
say, not
yeah,
chemicals.
yeah, he was used to that fresh Tide smell, right? Like as so many of us grew up with. And so I get it. I grew up with that too. But just rewiring in his brain of like, well, that's because that has chemicals and chemicals can disrupt your hormones. And especially when we want a safe home for our children and we want to try to conceive, naturally, like we want to lower that toxin burden. So it's just getting them on board, I think is huge. And another big one is what you are storing your food in. You want to make sure you're using glass containers, especially with heated food. We do not want to put heated food in plastic containers. We don't want to heat up food in plastic trays. And so this is important for your spouse to get on board with because you're living together. And if they're reheating your leftovers in plasticware, like those microplastics are going to you too. And why this is an issue, it throws off your hormones. And so that can disrupt your hormonal cycle and your fertility, everything. But it's also going to impact their sperm health and sperm motility. And that's what's so important about the male factor of fertility. And we're seeing this across the board that levels of testosterone are significantly dropping in males, which is extremely alarming. And so this is not just a women's issue, this is a male factor issue too. And part of what is impacting, sperm health is microplastics, is chemicals of, their cologne or their body wash. And so just gently encouraging your partner of like, hey, I bought you a new body soap, I bought you a new cologne. And so starting to swap out their things too is huge. And then in terms of supplements for them, Full Well does have a male multivitamin. And so I just recommended this for a patient's husband. It was so cute. He came to the appointment with her. They are wanting to try to conceive within the next year and just do whatever they can to optimize that. And we got both of them on Full Well. You can bundle it together, which is awesome. CoQ10 is included in kind of that male multivitamin, and that is going to up their antioxidants. And of course, we can do this from a diet approach too. I'm like increasing the amount of berries you're eating, increasing the amount of whole foods. So it's really doing very similar to what the woman is doing from a nourishment standpoint, but just understanding he plays a role in this too. And it's not just the woman.
Yeah, and they also have a fertility booster too.
They
That's for women
do.
and men. And that has the NAC, which I have read some good research on NAC and fertility, especially those who maybe have a history of amenorrhea and stuff like that. But yeah, they have so many. I'm going to link all these products because I didn't think about that. These are so good. So
Yes.
yes, taking some of the pressure off of you of like, and exactly what you said. Like, I love that you focus on like, you can control so much, but then also trusting that your body is not where you used to be. Like, you've worked really hard with me, with you, on your own, whatever it is, to educate yourself and to really set you up to be a different human and a different biology than when you first started this journey.
Absolutely.
Yeah. So to wrap up, I always ask my guests how they're nourishing themselves recently. So especially knowing that you are in your second trimester, you just entered it, right? With your fourth.
Mm-hmm.
Is there any specific way that you are nourishing yourself spiritually, mentally, emotionally, physically right now?
Ooh, I love this. I'm from all the dimensions of health. So, in terms of like physically, to just touch on like what I personally am doing supplement wise, I'm taking Full Well prenatal, all 8 pills every day. I'll do 4 in the morning, 4 in the evening. I also do their DHA EPA fish oil. So I love that that is separate from the multivitamin for optimal absorption. So I'll take 2 pills of that each day. I try to work in organ meat into our diet 3 to 4 times a week. Otherwise, I supplement with it. I do 2 pills of that when I supplement with it, not the full 4, just because of everything that I am already getting from the prenatal. And then colostrum has actually been my new like kind of nourishment routine. So in the evening, I will do a scoop of colostrum in water and froth it up with some magnesium as well. Do like a little bit of perfect supplements of magnesium and then cowboy colostrum, froth it up, and it's just like a good cozy drink. And then movement, I am just now kind of coming out of that first trimester rut, if you will, of just first trimester really slowing down. And now I'm so excited to like have more energy, get back into the gym versus only mat-based kind of work, and build in more resistance training. I'm super active like with my kids. And so that's been really fun. And then spiritually, this is my biggest struggle right now with 3 kids at home and having been in that first trimester where I was prioritizing sleep. is not really having as much stillness or quiet time to myself, which from a spiritual aspect is so important to me. And so just getting up before my kids again has been huge. And a lot of times my 17-month-old will get up first. And so I'll take him on a walk, like a sunrise walk, and he is quiet. He loves being in the stroller. And I just get that time to like reflect, to pray, to be in quiet, to be in stillness. And that spiritually has been really helpful.
I love that you hit it from the different angles too. And
Yeah.
yeah, I think you're a really good example. Like I look up to you so much in terms of like you are a business owner, an entrepreneur, and I think you hold a really good balance of taking that time for yourself and it making you a better mom and a better, friend and wife versus women. There's almost like this badge of honor of being like selfless as a mom and like putting everything, everything's about the kids and of course, like sometimes, and it's so, so important to take that time for you and to really nourish yourself from all aspects. And so you do a really good job of that. And I think it's so, so cool to see you go through. Like, I started working with you when you were, I think it was like beginning of your third pregnancy.
Yes, it was.
Yeah. And then after, and then, now again. So you do a great job balancing all of that stuff.
Thank you so much for saying that.
All right. So if you enjoyed this episode, lots of goodies in the links that we talked about of different supplements, different programs. I would highly encourage Dr. Kayla's programs. I mean, she talks about them a lot, and there's just so much goodness in those. And again, just taking the guesswork out of these things too, like really knowing how to listen to your body, what exactly your body needs throughout your pregnancy fertility journey is so, so helpful from an expert like her. So check those out. And if they want to find you and learn more, where's the best place to connect?
Yeah, Instagram is where I'm most active in terms of social, and I love sending voice messages or DMing. So if you have like specific questions, dropping them there is best. Otherwise, check out my website, which she's linked in the show notes with the specific areas, but drkaylaborchers.com, at Dr. Kayla Borchers on Instagram. All the same, makes it nice and easy. And then my podcast is Holistically Well. So that is the like title of each of my programs, Holistically Well, pregnancy, preconception, etc. So having a podcast now where I can deep dive into things such as Taylor is doing here on She's in Sync has been super fun.
Awesome. So definitely check her out in all the places. And if you're listening to this episode and you are at the stage where you are preparing to stop birth control and want to optimize your fertility within the next year to get pregnant, then I have a special treat for you. Having a clear, expert backed plan is everything. Despite what doctors say, just stop birth control and start trying for a baby, it doesn't usually go that smoothly because you need to remember that birth control impacts your body in a variety of ways, including not just your hormones, but your gut, your minerals, a ton of different things that will negatively work against you when you're actively trying to conceive. So, this is exactly why I created the Birth Control Breakup Accelerator. It's a 6-week fast track program to help you transition off birth control safely while supporting your hormones, fertility, skin mood, and cycle health. Inside, you'll get matched to 3 targeted tracks based on your top symptoms and goals. There's an acne and gut track for the woman dealing with or dreading breakouts after stopping birth control, bloating, or any other digestive symptoms. Think gas, diarrhea, chronic constipation. The next track is the painful period track. If you're afraid of cramps coming back, heavy cycles that leave you changing your tampon or pad every hour, sometimes multiple times an hour, and your life revolving around your period, perhaps you were put on birth control to quote unquote help with your period pain or your heavy cycles, then this track is for you. And last but not least, the PMS and anxiety track. This is for anyone feeling emotionally off or disconnected or overwhelmed and anxious all the time and wants more than your labs look fine. Here's a prescription for an antidepressant, cookie cutter recommendation by their doctor. So this takes out any of the guesswork and there's no generic protocols here. Each track includes 2 targeted functional labs, a hair tissue mineral analysis, and either a GI map, which is a functional stool test or comprehensive stool test, or functional blood labs, the kind that your OB or doctor will not run on you to uncover mineral, gut, and hormone imbalances that can sabotage your cycle and fertility post birth control. So, after completing either of the tracks, you'll walk away with real data, a customized step by step protocol, and 6 weeks of private support from me. So, you're never Googling how to stop birth control and get pregnant. ever again. So, if you're ready to stop birth control, boost your fertility, and feel in control of your health, the accelerator was built for you. If this sounds like something you're interested in, go ahead and apply in the link in the show notes below, and we'll schedule a free strategy call to chat through which track is the right fit and whether this offer is best for you. Thank you so much for listening, and until next time, stay nourished.